Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 562 of our pharmacotherapy series, which majors in sleep disorders. The first case reads, PCB, a 36-year-old man, is requesting a medication for treatment of his sleep disorder. He returned to Boston, Massachusetts, from a month-long business trip to California 2 days ago and is now having difficulty falling asleep. When he initially arrived in California 4 weeks ago, he went to sleep immediately at 7 p.m. and awoke at 3 a.m. His sleep pattern adjusted during his 4-week visit in California, but upon returning to Boston, it now takes him 2 to 3 hours to fall asleep. He has difficulty awakening in the morning and, as a result, sleeps past 9 a.m. He needs to be able to wake up by 6 a.m. and be alert during the day in his job as an accountant. So my first question to you reads, what information provided by PCB is important in the assessment of his sleep disorder? What additional information should be obtained from PCB to assist in the assessment of his sleep disturbance? PCB describes a circadian rhythm sleep-wake disorder, specifically sleep phase syndrome related to a time zone shift, previously referred to as jet lag. His major complaint is difficulty falling asleep and awakening later than desired, because he reports no trouble staying asleep or awakening too early. It is important for PCB not to be sedated during the day so that he can fulfill his job obligations. Additional information needed from PCB includes the duration of insomnia, methods already tried to relieve insomnia and their efficacy, concomitant medications, coexisting medical conditions or psychiatric disorders, alcohol use, caffeine use, and current life stressor. PCB should be advised that assessing all of the aforementioned information is necessary in treating his sleep problem. In response to your additional questions, you learn that PCB has no medical problems and takes no prescription medications. He has been taking pseudoephedrine at night for nasal congestion since returning from California. He denies drinking alcoholic beverages and coffee, but admits to recently increasing his cola intake from infrequent consumption of 1 to 2 cans between lunch and bedtime to try to stay awake. He denies a long history of sleep disorder, but adds, "I have not been able to sleep as well since traveling. I don't know why." So my next question to you reads, what factors could be contributing to PCB's complaints? Several factors are contributing to PCB's type of sleep disorder. His circadian rhythm has been disrupted because of travel, but he also takes a stimulating decongestant, i.e., pseudoephedrine, and drinks a caffeine-containing beverages, i.e., average can of cola has about 35 milligrams of caffeine. PCB consumes 35 to 70 milligrams per day. In addition, he sleeps in new surroundings that may require time for adjustment. All these factors can contribute to difficulty in falling asleep. Circadian rhythm sleep disorder results from a mismatch between the sleep-wake schedule required by a person's environment and the circadian sleep-wake pattern. The next question reads, PCB would like to purchase a non-prescription sleep medication. What would you recommend? An individual risk versus benefit assessment is essential before recommending any medication, including over-the-counter products. Although over-the-counter products, i.e., antihistamines, melatonin, valerian, and other herbals, are commonly advertised as sleep aids, data supporting the use of these products are limited. Antihistamines can cause drowsiness and may help patients fall asleep. The ability to cause sedation does not necessarily lead to hypnotic efficacy. Some patients do not feel well rested the next day after taking an antihistamine, but instead feel slow, lethargic, and not mentally sharp. This hangover effect can be significant and may be related to the lipid solubility and central histaminage, H1, and muscarinic blocking effects of the antihistamine. Antihistamines with low lipid solubility, e.g., cetirizine, loratadine, do not cross the blood-brain barrier readily and do not cause sedation. Although diphenhydramine is the most common antihistamine found in non-prescription sleep medications, some preparations contain the antihistamines doxylamine or hydroxyzine. The next question reads, what additional counseling is needed for PCB? Tolerance can develop to the sedative effects of antihistamines after 3 to 7 days of continued use. Because of a high incidence of daytime sedation and risk of cognitive psychomotor impairment, antihistamines are a poor choice for PCB, an accountant who must stay alert and functional throughout the day. Any attempt to manage PCB's sleep disorder should start with non-pharmacologic interventions before initiating any drug therapy. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom, and if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arora, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 563.